Dipeptidyl peptidase 4 inhibitors, add on to insulin, reduces the risk of all-cause mortality in diabetics. A study had shown that early use of insulin along with oral anti-diabetic drugs reduces the glycated hemoglobin A1c, resulting in low rates of hypoglycemia. Dipeptidyl peptidase 4 inhibitors are oral hypoglycemics, which may improve the glycemic control and decrease postprandial hyperglycemia. This study was performed to compare the risk of all-cause mortality between dipeptidyl peptidase 4 users and non-users, along with insulin therapy in diabetic patients. Individuals aged between 18 to 100 years, with newly diagnosed type 2 diabetes mellitus, and who were taking insulin therapy, were included in the study. Individuals with type 1 diabetes, or rheumatic heart failure, or stroke, or peripheral arterial occlusive disease, or heart failure before the index date, were excluded from the study. The retrospective study included 3,120 patients, who were divided into two groups. Dipeptidyl peptidase 4 inhibitors users group included 1,560 patients, and dipeptidyl peptidase 4 inhibitors non-users group included 1,560 patients. All-cause mortality was the primary outcome of the study. The number of all-cause mortality cases was higher in dipeptidyl peptidase 4 inhibitors non-users group, as compared to the dipeptidyl peptidase 4 inhibitors users group. The incidence rate of mortality was higher in dipeptidyl peptidase 4 inhibitors non-users group, as compared to the dipeptidyl peptidase 4 inhibitors users group. The risk of all-cause mortality was reduced by using dipeptidyl peptidase 4 inhibitor in diabetic patients on insulin therapy. Dipeptidyl peptidase 4 inhibitors may be added to insulin therapy for better glycemic control.